For those who don't know, I'm Shanae Vicks. I am the Prince George's County Health Action Coalition Manager. I work at Prince George's County Health Department within the Office of Assessment and Planning, and I am really excited to have you all join us today. To give our official welcome, I would like to introduce Dr. Sharon Gibbs Cooper. Dr. Cooper works at the University of Maryland, I think you told me for over 20 years, yeah? And she's one of the co-chairs for our Healthy Start work group. Dr. Cooper is amazing. She has a wealth of knowledge and experience working with community-based initiatives, really in particular bringing resources to the community through unconventional platforms. And she has experience in public health, health equity, the reentry realm. And she also sits on the Maternal and Child Health Board for the NAACP. So she does it all. So I just want to introduce Dr. Sharon Gibbs Cooper, if you want to give our official welcome.
Yes, good morning, everyone, and thank you so much for being part of such a dynamic group. I am looking forward to all of us collaborating and having just warm discussions about bold ideas and innovative approaches that we can help bridge any gaps that we have in the community, utilizing various resources to be able to advance not only initiatives, but viable solutions and health outcomes that can improve not only life, but all other aspects of life. So taking a comprehensive approach. So thank you. It is a pleasure to be a part of this group, and I look forward to working with each and every one of you. Thank you so much.
Awesome, thank you. So I'll go ahead and briefly walk us through today's agenda. We will start by just grounding ourselves in the purpose and the vision of this work group, and then we'll talk a little bit about our roles in the work group, and then we'll revisit some of the data that frames why this work matters. From there, we'll connect our discussion to our Community Health Improvement Plan, or the CHIP as we call it, and how this group plays a direct role in shaping it. And then we'll move into a short interactive activity that focuses really just on the strengths and alignment and opportunities within our work group. We want to understand who's in the room and how we can move forward together. And then we'll close with some community announcements before we adjourn. But again, we thank you all so much for being here. Today is all about collaboration, so we encourage you to actively participate, share your thoughts, push our thinking, and bring your perspective. So we'll go ahead and get started. So to ground our initial meeting, again, I just want to share a little bit about the purpose and vision of the Healthy Start work group. This work really just aligns directly with priorities that are identified in our Community Health Assessment, which is also called the CHA, as well as our Community Health Improvement Plan, or our CHIP. And we'll talk a little bit more about those shortly. But at its core, this work group really exists to bring partners like you all together to collaboratively identify some of the maternal and infant health concerns here in Prince George's County, and to really align ourselves around meaningful, equity-centered strategies to address some of the disparities that we know exist as well. We want to see a county where all birthing people and infants are supported with access to quality prenatal as well as quality postpartum care, which we know will lead to healthier pregnancies, healthier births, and a stronger start to life. And that vision simply is not possible without the expertise and the experience and the commitment in this room. So we know that there are a plethora of ways that maternal and infant health can be addressed, but the one thing that I say remains constant: this coalition, this work group, this work cannot be done successfully without you all. So your participation, your insight, your passion, it is all important. It's all instrumental to the work that we do. And as members of this work group, we're simply asking for 1 hour of your time per month to just actively engage in our discussions, to bring your system-wide lens and perspective. You all carry a wealth of knowledge. You all are familiar with the data that exists. So bring that on to the group so you can share with us to support some of the work that we're doing. We want to center equity and lived experience in our discussions, as well as some of our planning efforts. We want to collaborate with you all on strategy development, particularly for our chip. And then we just ask that you all serve as a bridge between this group and your organization. You all are doing phenomenal work out there, and we want to know what's going on out in the community so we can partner with you, we can support you, we can cross promote, right? So this is all about shared leadership. It's all about shared responsibility and shared impact. And the great thing is that some of this work already started. So last month, many of you actually participated in a root cause analysis discussion with my colleague Deborah. And together you all explored some of the underlying drivers of maternal and infant health challenges, combining some of the data, your professional experience, the lived experience from some of your clients. And at this time, I do want to invite my colleague, Deborah Collier, to just briefly summarize that discussion for those who may not have been there. Deborah?
Can everyone hear me okay?
Yes.
Okay, great. Like Shanae mentioned, we kind of went through the discussion. We started out with our problem statement, and then we kind of utilized some evidence from the 2025 CHA. So the problem statement that we started with for our root cause analysis discussion was many pregnant people lack consistent prenatal and postpartum care, particularly those with Medicaid or without insurance. And then some of the evidence that came from the 2025 CHA. So since 2013, the county has had higher percentages of births with late or no prenatal care compared to the state, with 11.8% of the births in 2022 receiving late or no care versus 7.5% statewide. And then maternal mortality rates remain higher than the Maryland average, and the percentage of low birth weight infants has exceeded the state rate since 2013. And so as a result of that, we kind of had a lot of great discussion regarding kind of why we're seeing some of these, why we're seeing this, this level of disparities and within our maternal and child health population specifically, and trying to understand what that will look like for those that are specific to like Medicaid or those without insurance. And so we kind of had a lot of different talking points. And there was a lot of great discussion around this problem statement and then the evidence that we provided as well. And so after we had some discussion, we kind of used that information from that discussion to kind of come up with utilizing the 5 whys approach. We also utilized a fishbone diagram to kind of visualize as well kind of some of the discussion points that came out of that, and kind of use the fishbone to kind of categorize that. And then as you can see on the side of this slide, we have the 5 whys. So like Shanae mentioned, we kind of started off our discussion with that statement, and then we kind of asked just a series of kind of why statements about why questions about why we're kind of seeing what we're seeing in terms of prenatal and postnatal care. So looking at the head of the fishbone, it kind of shows the core problem, which is kind of inconsistent prenatal, postpartum, and infant child care or infant care. The bones show kind of major drivers where you have access issues that include too few Medicaid providers and transportation barriers. Capacity challenges was another driver, just kind of reflecting on our federally qualified healthcare centers, the strain that they're having and the long wait times that they have. Some of the other discussion points that created kind of the navigation driver was issues included like complicated enrollment and confusing referrals. And then also, if you go down on the bottom of the fishbone, the mistrust and kind of the culture, looking at language barriers, and then just overall medical mistrust that are influencing care and utilization. The other was maternal and child health education. So those education gaps, so meaning that families may not know when or where to seek care. And then the last, looking at that continuity driver, just like issues appearing when it comes to postpartum care. So kind of drops off, and also infant well visits that can sometimes be missed was also mentioned. So looking at those kind of drivers, we also came up with now kind of our 5 whys. So the first listed there was access to maternal and child care is very limited. The second was community providers are over capacity. And then the third, our system often prioritizes kind of acute care over preventative care. And then the fourth, navigation complexity and kind of looking at cost burdens. That discourage families. And then the fifth why kind of, was just kind of at the root, looking at kind of structural underinvestment and workforce gaps, and just those inequities were some of the things that came out of it in the discussions that we had. So one of the biggest takeaways is that, again, we've kind of done this with all the work groups in the coalition, and one of the things that we've noticed across all the work groups is that we notice that these are not individual barriers or individual obstacles. They are, just overall, we're all kind of, need to be a part of the solution. And so these aren't individual problems or individual choices. This is just a system. We need to kind of come with a system resolution for this, and not just with maternal, in regards to maternal and child health, but with the other priority areas that were outlined in the CHA as well. So if we want to strengthen community care, workforce capacity, and kind of navigation support, we can definitely make some inroads and improvements in our maternal and child health outcomes if we want to kind of look at some actionable things that work groups can do to kind of be helpful here.
Awesome. Thank you, Deborah. I don't know if you are open to taking questions. If anyone has
Yes.
some, we can take a minute or two for questions about the data. And if not, we can
Yep.
move on to. And if you don't mind, Deborah, if you can put your email in the chat, if anyone wants to follow up with you separately, we can offer that as well.
Okay, will do.
Thank you. Any questions about the data so far? Okay. Well, hearing none, we can move on. Again, thank you, Deborah, just for providing us with that overview. I think one thing becomes very clear is that we all know these disparities exist, and this isn't just abstract, right? We know that this reflects real families in our community, and we know that disparities are tied to unequal access to quality prenatal and postpartum care. We know that where you live, what insurance you have or don't have, what language you speak, all of these can affect birthing outcomes. And that's why an equity-focused approach is so important in the work that we do. It's about meeting people where they are, centering resources where they're needed most, and addressing some of those systemic barriers like insurance gap and transportation, language, and things like cultural competence. And I think what's important is that equity really asks us to look at the system and ask questions like, what is standing in the way and how do we remove it? And when we do this, we know that every parent and baby has a better chance to thrive in our communities. And so for our community, that means fewer preventable complications, healthier pregnancies and births across all neighborhoods, stronger families, right? For mama and daddy and baby and grandparents, that the support system as a whole can be stronger. And so by keeping equity at the center, we're not just improving individual outcomes. We know that we're strengthening the health and well-being of our community as a whole. And this is particularly important as we develop our community health improvement plan. Again, we call it the CHIP, specifically as it pertains to like the strategies that we're trying to develop and utilize to address our problem statement. So I want to share a little bit about the CHIP for those who may be unfamiliar. And for those who are, I ask for your patience as maybe a slide or two might be familiar. But this CHIP is really our community's roadmap for how we want to improve some of the community health outcomes and how we want to advance equity here in Prince George's County over a 3-year period. It's collaborative, it's community driven. We know that the CHIP is data informed, and what it is set to do is really help us focus our collective efforts on a lot of the health challenges that matter most to the residents of Prince George's County, and it helps us align partnership around some of those shared long-term strategies. So thanks, Deborah, I appreciate you. And so with our CHIP, we follow what's known as the MAP 2.0 framework. So that's mobilizing for action through planning and partnerships. And MAP 2.0 is a nationally recognized approach that helps us translate data into coordinated action by emphasizing things like strategic thinking, continuous learning, collaboration. And there are 3 phases to the framework, but what it really does is help us prioritize the issues that exist, helps us identify resources and take a more coordinated action that reflects what truly matters to the community. And by doing that, we can use some of the data, we can use lived experience, we can highlight and utilize some of those local assets and those resources to develop a coordinated plan to address the problem. Now, this work really began with our community health assessment, which Deborah mentioned, which was published this past June. And it really helps us understand the what. So our child helps us understand what's happening in our county. So everything from the health outcomes to the conditions people are living in and the factors that influence their health every day. And then we use the MAP 2.0 framework to guide us into translating that child data into those actionable strategies that we develop with the chip to hopefully make a real difference. So again, we like to say the child tells us what's happening. Our root cause analysis discussions help us better understand why the problem is happening. And then the chip defines how we're going to respond together. But before we delve into all of this chip work, I do think it's really important to frame this work using the visual of interconnected gears. And I have to give credit to one of my fellow co-chairs for our Healthy Minds work group. She kind of came up with this visual, and I think it's a great way to kind of put the coalition in these work groups into perspective. And really, this idea of interconnected gears is that this coalition functions like a set of gears, right? And each partner here is a gear. Some of us are large, some are small, and at times we even move in different directions. We know on their own, gears don't move much, they don't go very far, but when they're intentionally aligned, the entire system can move more smoothly, more efficiently, and even with greater power, right? So each one of us, we all bring different perspectives, we have different experiences and ways of working, and that diversity is what I think is the greatest strength of our coalition. So the key is all about how we want to position our efforts and position ourselves so that we complement one another and so that together our collective impact is far greater than what any one of us can achieve alone. Excuse me. So with this visual in mind, I think it's important to have an understanding of how we align and where we can collectively influence change. And so we want to use this time to hear a bit from you. We want to know who's in the room. So what I'll do is I'll share a prompt, and then I'd like to ask you to first introduce yourself, your organization. You can tell us about your role, and then you can provide your response to that prompt. But the goal here is really just to move from general introductions to better understanding where our efforts might intersect and where we can collectively move the needle. So I'll begin by lifting up the assets in this space. We'll start with our strengths. If you can introduce yourself, your name, your organization, your role, and then tell us a little bit about maybe what strengths or relationships, perspectives you bring to the world of maternal and infant health. And if anybody wants to be our brave starter, I can call on someone to start us off. Dr. Apgar?
Hi, good morning, everybody. My name is Dr. Andrew Apgar. I've been an OBGYN in Montgomery County for 25 years. And I came to CCI as the reproductive health medical director and the chief medical officer about 2 years ago. I think I'd like to believe the strengths that I bring to here are experience, attachment to the community, albeit Montgomery County with a little bit different demographic. But I do have a lot of significant relationships, not only with patients, a vast number of patients here in the county, but also a lot of people who run hospitals and can hopefully open those doors of access, specifically MedStar as well as White Oak and Shady Grove as well. So my hope is to bring that experience and also a lot of cultural humility to understanding. And I was the one in the last one that said that I think we should just openly and transparently take the blame, especially for the flat across the board outcomes that are worse for all of our African American women. And if we take that blame and admit the problem and transparently talk about that in our story, then I think we're going to build trust. And I think if we build trust, I think we're going to gain people to come through the doors that are open. Thanks.
I love that. Thank you, Dr. Apgar. Great perspective. And thank you for your contribution to this work. Annie, would you like to share?
I know you were going to do that.
I'm just going down the list, but it's good to see you.
It's good to see you too. It's good to see you too. And thank you, Dr. Apgar, for starting us off. It's going to be a tough act to follow. So hi everybody, I'm Annie Oli. I manage the maternal health program at Primary Care Coalition. And our main project right now is working with the Maryland Department of Health on the Integrated Maternal Health Services project, specifically doing the quality improvement work around implementing the digital risk assessment forms, both on the prenatal and postpartum side, and also strengthening perinatal care coordination in Maryland as a whole, although our pilot jurisdictions are on the Eastern Shore, and importantly for this group, Prince George's County. So we are working with several prenatal practices and hospitals in Prince George's County, or who see Prince George's County patients, in order to implement these digital forms and also optimize their workflows to ensure that patients are being connected to the care that they need. And we've had several opportunities to work with this group and also some other groups, thanks to Dr. Cooper and Sharon, who are on, to make connections, and we really have found that, building relationships and making sure that we are all leveraging each other's, assets, or our whatever it is we bring to the table is absolutely key in working on improving these outcomes. And the program is going to expand. I can't give you a specific timeline, but we're hoping to bring on more practices and eventually get set up to expand statewide. So all the folks in this room will be really helpful to us for for optimizing that and making sure that we are doing the best that we can to provide the best resources to patients as possible.
Thank you. Thank you for your contribution to this work. I'm going to keep going down this list here in no particular order, but Crystal, would you like to share?
Good morning. My name is Crystal Green. I am the Health Quality Coordinator here at Elaine Ellis Center of Health. Those who are not familiar with Elaine Ellis, basically we are a FQHC that's located. We have two locations, one in DC, right by Eastern Avenue, right on the border. So a lot of our patients are the people that do live in that Capitol Heights area. We also have our other location is located in College Park, right on Rhode Island Avenue, or that crazy intersection, as I call Baltimore
Yes.
Ave, and Route 1 and all that kind of stuff and everything. I guess one of the things that reason why I actually joined this call is because I think our center could use to strengthen our relationship with maternal and infant organizations, to strengthen that relationship. We've had a decrease in numbers for GYN and all that kind of stuff, and we're looking to improve those numbers again, with trying to bring more initiatives to our patients that are, maternal and infants and all that kind of stuff. So one of the resources that we are looking to utilize is we actually do a lot of community health events. So we're actually going to start marketing and target that, I guess you could see, that age group, so they can include their babies and young children and everything, so they can come here and get all their needs taken care of here, health wise and everything. I think the more we try to gear towards that age group and trying to bring them here for healthcare and everything, the more that we can look at other partnering initiatives and other organizations to provide assistance that they need to help, bring better care to their young, and, all that kind of stuff and everything. That's just why I'm here and everything. I know at one point our GYN was doing OBGYN, the whole gamut from when you find out you're pregnant until you deliver, but that has changed. I think they're looking to hire again an OBGYN that can provide care for our pregnant patients that are over 27 weeks up until they deliver, and then they can still continue we were already continuing that care once you delivered, pretty much. But they can come here and we can look for those resources.
Awesome. That's great. Thank you so much, Crystal.
You're welcome.
All right, moving on, I have Jennifer.
Hi, I was just looking to see if there's more than one of us here. There tends to be several Jennifers around when I
Oh,
join
I'm
a
sorry,
meeting.
Jennifer
So just,
Klein.
yeah, okay, just making sure it's me. So my name's Jen Klein. I am one of the OB case managers with WellPoint. There are a couple of us here today. We are here to just kind of join in on the conversation, and all of us have been labor and delivery nurses. Daisy actually still is actively as well. So, we're just here from the bedside perspective and also from our work with case managing, and we have many of our members are in Prince George's County, so we see it all, and we're kind of here, at least me personally, to kind of see what else is going on, maybe if there are resources, programs, things out there that we're not aware of that we can share with the members that we work with. Also happy to take back any ideas and suggestions and ways that WellPoint can be of service. Obviously, we can't make those decisions, but we can take back information. And I know there are groups of people that are always looking to grow and learn from what the needs are in the community to see what else we can offer. So that's why I'm here.
Thank you, Jennifer. Appreciate you being here. Let's go to Mindy Pierce.
Hey everyone, nice to see you. My name is Mindy Pierce and I work with Annie Oley here at Primary Care Coalition. I serve as the Senior Director of Population Health, and I've been at PCC for just about 5 years. And one of the things that I oversee are all of the different population health programs we have, from the IMHS program that Annie works on, to our maternal, to our minority health initiatives, social determinants of health programs. We have a really what I think would be interesting to bring to this too is our workforce capacity program, where we think about how we can support those in the healthcare system. We do a lot of work on the entry-level healthcare workforce, getting them trained. Many of our participants are first-generation healthcare workers, or even first-generation workers in their family. English is a second language, so really helping to get into our hospitals and other healthcare groups around. So looking at that too. And then similar to Dr. Apgar, work with all the hospitals here. So I oversee Nexus Montgomery, so all of 6 hospitals in Montgomery County. So while I'm barely connected in with all the hospitals here, all of those neighboring hospitals like Suburban and White Oak that are right by Prince George's County help to connect. How can I help be a good connector for all of you in the ways that, while Suburban does not have maternal services there, but we have a lot of other connections in with all of the systems around. So PCC has been around for over 31 years and really works to administer the programs in with Montgomery Cares, our health centers here, and Care for Kids, and a number of other programs. So excited to be involved. And I also serve on Healthy Montgomery as well. So with the Healthy Montgomery's chip and other things too. So thank you.
I love that. Thank you so much, Mindy, and appreciate your contribution to this work as well.
Sure.
Naya?
Sorry, took a second for me to get off mute here. Good morning, everybody. I'm happy to be here. As for me, I'm just a Prince George's County resident and community member. I'm also a data specialist that's very passionate about maternal and child health. I do have a master's in public health from University of Maryland, go Terps. And I have also done some postpartum care in my area, and I'm looking to complete my doula certification soon. I also have some, I would say, a very adjacent experience, lived experience rather. I grew up in a home where my mother did in-home daycare, a licensed in-home daycare. So I kind of saw firsthand the impact and the effect of children and families having that continued support and really needing, care and assistance and compassion. And so I've just kind of grown up with that my whole life. From a professional standpoint, I have started recently with a new group called More Than Food Consulting, where we believe that it takes more than food to end hunger. And with this group, I work on increasing the capacity of food pantries nationwide so that they can implement different um, procedural operations that amplify autonomy and dignity for folks that come to visit the food pantries. So kind of a scatter across the different things, but I'm really happy to be here. I'm glad that this is a group. It sounds like everyone has great experience, and I'm excited to see the work that we can get into.
I love it. Thank you so much, Naya. We appreciate your contribution as well. This is
Yeah.
great. Daisy?
Hi, my name is Daisy, and I work with WellPoint. I'm the OB nurse case manager. I work with I'm in a team with Jennifer Klein and Carrie Scheck. And I echo what Jennifer said. We're here to provide like support to meet our members' needs. I actually do talk to a lot of the Spanish-speaking population, and they do have a lot of language barriers that I try to help them with, like making their OB appointments, trying to get any additional support, medications from the pharmacy. Sometimes there's a lot of issues with them there. And then I also work bedside still at the hospital, so I also have that experience too.
Awesome. Thank you so much, Daisy. Thank you for your contribution. And we have, I know you mentioned Carrie. So Carrie, would you like to share a bit?
I don't have much else to add to what JC and Jennifer shared, but I'm one of the other OBCMs with WellPoint. Um, and I also bring bedside labor and delivery clinical experience. So we try to, we're able to bring that well-rounded care to our members. So I'm here just to see where else we can help meet our members' needs with, working together and how we can help and how you can help us and what else we can do.
Love it. Thank you. And Sharon. Hi, Sharon. Sharon Slutsky.
There I am.
There
Hi,
you
I'm
are.
Sharon Zaluski, and I was formerly the executive director of the Regional Primary Care Coalition, and now I'm joining you today as an independent consultant with an interest in strengthening, a general interest in strengthening the primary health care system in Prince George's County. I have a good deal of experience. I've worked with all the FQHCs in Prince George's County, Montgomery County, and the District of Columbia. I'm very familiar with the systems that are in place across the region and hope that we can pull out and replicate best practices related to maternal and child health. I also have perspective and hope that we bring perspective to some of the specialty or some of the subpopulations which are more vulnerable than others. And I particularly am interested in youth and pregnant and parenting teens, and also language and culture, overcoming language and cultural barriers across the system to make maternal and child health care more accessible to everybody. I mean, at a minimum, we should be guaranteeing a healthy start for every child, not only in Prince George's County, but across the region. So I am here to help and support this work in any way that I possibly can.
Thank you so much. I appreciate you being here. And I have Sophia. Do you want to share a little bit about yourself?
Yes. Hi, my name is Sophia Thompson. I'm an intern in the Office of Assessment and Planning, and I'm also an MPH student at the University of Maryland right now. So definitely as a student, I'm here to absorb and learn from you all and all of your expertise. But I'm coming from an epidemiology background, so definitely interested in the data aspects of disparities in maternal and infant health outcomes, especially in Prince George's County. So, have enjoyed working in the office, developing the maternal and infant health report.
Awesome.
And great to meet you all.
Thank you for being here, Sophia. Awesome. So There is a wealth of knowledge and experience in this room, and I love it. And I'm just so grateful for you all to be here and what's to come. And I want to be mindful of our time, but I do want to shift. In maybe 5 minutes, we can talk a little bit about even with all of these strengths, we know that families are still experiencing barriers. So for the next like 5 minutes, where do you see the biggest gaps or opportunities? And I know some of you touched on it a little bit in your introductions, but particularly for those families experiencing the greatest inequities, where do you see the biggest gaps or opportunities? And you are welcome to use the chat. You're welcome to unmute yourselves. Where do you currently see the biggest gaps?
Well, I guess I'll start. I think it's nutrition. That is a major component as far as bringing about a healthy pregnancy and healthy pregnancy outcomes. And just as one other person had said earlier, the case management component, being able to identify those needs and connecting individuals immediately in a timely fashion to accessible services that will be able to meet those gaps. And of course, the literacy.
Yeah, love that. Thank you. I see in the chat we have childcare for appointments, availability of appointments at OB offices. I have many members who say they told me they would call me for my next appointment, but no one called me and then nothing happens. Yes, thank you, Carrie. That's so true. Then when they get those appointments, what do they do with their children? So yes, thank you so much. Naya, I think there are gaps in postpartum care and resources, whether they be systemic or lack of community knowledge. That's a great one. Annie, trust of referrals offered and follow through. So Annie, in that sense, do you mean like they're just not sure that where they are being referred to is a trusted resource? Is that what you mean?
Well, I mean, I guess generally, I mean, a lot of things, but specifically for what we've experienced, there's a lot of distrust of government right now. And a lot of the mechanisms for referrals that our project is working on and the local health department and MDH are working on, come through the local health departments with the MCOs. And so, if a local health department reaches out, people might not be willing to answer the phone or talk to them, that kind of thing.
Yeah, no, that's good. You're absolutely right. Thank you. Thank you for clarifying. We have some more comments in the chat. Health literacy. Yes, trusting TikTok videos over clinical advice. That is a good one. Dr. Cooper, greater need for community health workers. Yes, to be built into the system of care. Love that. Carrie, lack of, I'm going to assume that's behavioral health support.
Yes, BH support, behavioral health.
Perfect. That's my acronym too, but I just want to make sure. Love that. Thank you. Lack of primary care providers. Yeah, these are all great. Awesome. Any other feedback?
I think in one of the earlier discussions that we've had is a lot of times people think of prenatal care during the time of pregnancy. But I think we look at if we take a comprehensive approach to care, you want the individual to be healthy before that person considers pregnancy. And that means looking at it's a holistic approach, looking at the blood work, looking at if there's a genetic history of diabetes, any history of thyroid, whatever it may be, some underlying issue that may impede or affect the pregnancy outcome.
That's good. Love that. Thank you, Dr. Cooper. Sharon, improving upstream knowledge and beliefs related to pregnancy and perinatal care. Carrie, Spanish-speaking providers or the lack of Spanish-speaking providers? Yes. Jennifer, those who do not have Spanish-speaking providers aren't always taking the time to utilize an interpreter. So true. Yes, I've heard that across the board. I've heard that from some of the CHWs I've worked with as well. That there's lack of interpreters available. So yeah, I love that. That's all great. Mindy, follow-up support after delivery. Very true. Change in requirement to contact currently in Maryland legislation for consideration. That's great news. Please keep us posted on that and how we can support. Sharing access to comprehensive continuity of care, including postpartum care and support. Carrie, I think there could be more education on contraception. Yes, I was a high school health teacher, and the things I could tell you the students believed in that in my time as a health teacher were terrifying. So yes, definitely more education on contraception, especially at an earlier age prior to high school, I think would be very helpful.
DPNAC,
Integrating,
which is also like birth spacing too for some of these pregnant and postpartum moms. A lot of our members we see within the next year coming through again with a new pregnancy,
yeah,
which most of the time is not necessarily like a planned pregnancy and it's very short intervals. So I think a lot of postpartum contraceptive education would be appropriate too.
that's great. I love that. Thank you for adding that. And then our last comment, integrating medical schools and nursing school students to fill the gap. That's a great idea. Thank you, Dr. Cooper. Awesome. I love this. Thank you all so much for your feedback. This is really great to kind of get our minds thinking and flowing to see who's in the room, what strengths we all offer, where maybe we can use some of those strengths to fill in the gaps. We know that there are system level gaps, which I think tells us something about where our influence and some of our efforts can and should focus. And then we have another comment, school health education and clinical care for youth. Yes, absolutely. So thank you all so much for this feedback. And this conversation will continue. So again, we know a little bit more about each other. We name strengths, we name those gaps. And now the real question becomes, what can this group meaningfully influence, right? Again, we know we won't be able to do everything, but we can do something. So over the course of the next few meetings, we'll actually start to identify and make a plan for what we think we could do exceptionally well, let's say in the next year or 3 if we're working on the chip, right? That we think would truly improve maternal and infant health outcomes, especially for those families who are most impacted. So we'll begin to move from this insight to action, and we'll really get into the work of developing this CHIP action plan as it relates to maternal infant health. So things like developing a goal, we'll establish some objectives to guide our progress, and then we'll co-create some actionable equity-centered strategies to really drive some meaningful impact in our community. And I'm genuinely looking forward to building this with you all. And in the meantime, if any questions arise after today, I'll make sure to put my personal email in the chat as well as the coalition email. It's a general email, and we'll make sure that we get to you all. But I do want to use the last few minutes to open the floor for community announcements. I'm going to actually turn it to my colleague, Ashton Jordan. We call him AJ. He's going to share some announcements with you all, and then we'll open the floor if any of you want to share anything as well. So AJ.
Hello, hello. Thank you, Shanae. So just going to go through a couple of announcements. Our first announcement is going to be the PG area plan listening sessions. We're pleased to announce that the upcoming FY26 area plan listening sessions, the goal is to gather meaningful input from residents, service providers, advocates, and community partners to ensure the FY26 Prince George's County area plan reflects the real needs, priorities, and lived experiences of those who live and work in the county. Particularly older adults, people living with disabilities, caregivers, and historically underserved communities. There will be 2 sessions where you can join either in person or virtually, and the dates and times will be listed and shared in the slides. The 4th annual Heart Health Equity Symposium will be on February 27th. The Open My Heart Foundation is going to be hosting that from 1 to 3 p.m. at Capital Region Health in Largo. So this free event will focus on heart health equity and closing gaps through new laws, and it's open to the community while seating is limited. So kind of on the first come, first serve basis. Next up, we have the GOAT Youth Mental Health Expo. So you can join the GOAT Expo team on Saturday, May 2nd at Bowie. Bowie, my bad, y'all. New to Maryland. At Bowie State University for a full day of workshops, resources, and live performances in support for the youth 16 to 25 and their families. So this event is free to attend. And again, we'll make sure that that registration link is available from the slides. Next up, we have the 2026 Camp NABI Youth Grief Camp. So Chesapeake Life Center just released their dates for the 2026 Camp NABI on August 7th through the 9th. This is going to be a full weekend overnight camp in Millersville, Maryland for youth ages 6 through 18 who have experienced the death of a loved one. You can reach out to our fellow coalition member, Carrie Stansel, for more information. Next up, we have a free prostate cancer health fair. This will be taking place on Saturday, February 21st from 10 a.m. through 2 p.m. at the Largo Kettering Perrywood Community Center. This event will provide free PSA screenings, expert speakers, survivor resources, caregiver support, and education for our community. Prostate cancer continues to disproportionately impact men in our region, and early detection saves lives. So your support in spreading the word can truly make a difference. And so we'll make sure that this is shared following the meeting. Just a few more here. So the All Cancer Support Group, Hope Connections in the University of Indy CAP region are hosting a virtual All Cancer Support Group on Wednesdays from 12 to 1 p.m. You can register to attend, to connect with others, feel supported, and gain additional information and resources to support your journey. Parks and Rec has their winter activities guide available for you all. Please take a look at the PDF. This is hyperlinked here. Again, this is also going to be shared afterwards, but you can find more information on pgparks.com as well. The Dine, Learn, and Move. You can join our community partners each month for 90 minutes of free virtual fun to get active and learn tips for making healthy choices. February sessions will focus on heart health and will take place Wednesday, February 26th from 6 to 7:30 p.m. Registration is required. You can email wellnessinfo@co.pg.md/US for registration information. Next up, we have the MedStar 2026 Health and Resource Fair. Please save this date and join MedStar Southern Maryland Hospital Center and Clinton Baptist Church for a day filled with educational resources and support at their health and resource fair. Saturday, March 14th from 10 a.m. to 1 p.m. at Clinton Baptist Church. If you would like to attend as a vendor, there is a vendor sign-up form hyperlinked on this slide. I believe we have just two more. So the UMD CAP region is hosting CDSMP classes. So this program is designed to empower individuals living with chronic diseases by providing them with the tools and resources needed to manage their health more effectively. The workshop convenes in person for 2.5 hours each week over the course of 7 weeks, starting Tuesday, March 24th. You can visit their website for more info and to register. And last but not least, the Medicare Diabetes Prevention Program is a free program to help reduce your risk for type 2 diabetes. If you or someone you know is at risk, please call or text the number on the slide to attend a virtual information session held every Monday from 5:30 to 6 p.m. via Zoom. The link to join is provided on the slide. And with that, I'd like to pause to see if there are any community announcements.
I'm not sure if this qualifies as a community announcement, but we PCC are recruiting for our next cohort for the patient, family, and caregiver advisory group for the IMHS project. And we are focusing on this cohort on folks who are Spanish speaking only, because we now have a Spanish speaking facilitator, which is going to be really great to get some candid conversations. We do have updated flyers. I know that some of you, if not all of you, have seen our prior flyers, but we really want to make sure that we are centering patient voices on this. So would it be okay, Shanae, if I shared the updated flyers with you all, and then if well, know folks or know community organizations that we could reach out to, there is a monetary incentive. It's a $100 gift card per hour of participation, and we round up. So if it's an hour and 10 minutes, it's 2 hours.
Wow.
Yeah. So, anyways, we're really hoping to get a robust cohort this time around, and would love your help on that.
Awesome. That's fantastic news. Thank you for sharing that. And yes, please email me the flyer. If you can do so, maybe like before tomorrow at noon, I'll make sure that goes out with some of the additional announcements, as well as a copy of the slides and the recording of this meeting as well.
Will do.
Thank you for that. Any other announcements from our community partners? And if something comes to mind later, you can send me that as an email as well. Awesome. Okay. Well, as you can see, there is a lot going on in our county. So this is our opportunity to kind of just share with you all what's going on. We're happy to cross promote. So as things come up, you can send them to me via email so I can make sure they're included in the presentation slides. I don't just share announcements with this work group. I share community announcements with all the work groups. So it's a great opportunity to get the word out, to cross promote, and to get this information out to our county residents as well as our community partners. But I do also just want to take a moment. We are currently working on rebuilding and enhancing our coalition directory. So if you have a moment, you can go ahead and scan this QR code. We'll also send the link out following this meeting. But really, we're just asking our partners to just update their contact information for the coalition directory. We want to make sure that we're maintaining an accurate record of our coalition partners. And we're also going to utilize the directory as a way to make sure that we give credit to everyone who is participating and helping us with our chip development process. Because in that document, we're going to list everybody's names and their organization. So please feel free to update your contact information or provide your contact information so we have that on file. And again, I'll make sure this gets sent out after the meeting. All right. And I also wanted to just provide you all with a quick snapshot of the upcoming work group meetings for the remainder of this quarter. As you can see, we have quite a few other work groups. You are welcome to participate in any of the work groups. This is an open coalition, especially during this chip planning process. You know, you are welcome, and we welcome your shared expertise, your lived experience, and your assistance with developing some of the action plan items that will go into this chip document. But our next Healthy Start meeting will be next month. So it's next Thursday, March 19th, same time, same place, and virtual. We also do full quarterly meetings with our coalition, which you are welcome to participate in. This will also be virtual. It's coming up Tuesday, March 10th. There is a link to register. This is where all of our work groups come together. We have community residents that come out. The health officer comes, some of our deputy staff come, assistant directors come out. So it's a great time to learn about what everybody is doing in the coalition and to see where we can align ourselves. So we invite you all to that. Again, the link to register will be on the slide, and I'll make sure that goes out in the follow-up email as well. Yes, I can do that. AJ, do you mind including that link in the chat for me? And as always, I would just want to again thank you all so much. I know this was our first time meeting, but I'm truly looking forward to the work that we have ahead. Thank you again for your insight, your partnership, and we really appreciate y'all being here today and continuing to do this work together. So thank you all so much. I'm giving you back 5 minutes, so get an early lunch in, and I look forward to seeing you all next month. Thank you so much.
Thank
Have a
you.
great day.
Thanks. Have a good afternoon.
You as well.
Thank you.
Bye.
Have a good one.
You too. Thank you. Awesome, awesome, awesome. All right, let me stop sharing.